Welcome, welcome to the MBLEx review course. My name is Jodi Skulls. I am your instructor for today, and in general, I am your instructor. And holding a vision, actually, for you as you become a licensed massage therapist. You know, in my mind's eye, it's kind of funny. You see, we're in the view right now that is the gallery view, so you can see everybody who's in class. And let me tell you, I already see it in my mind's eye for you that you are licensed massage therapists. For real. I already see it in my mind's eye. And this is just a matter of logistics, right? Yes, it's challenging logistics. And the MBLEx, not gonna lie, man, the MBLEx that test is a beast. It's confusing. It's meant to be distracting. It's something that you probably never did in school. And bonus, it's something that you may not even need once you start practicing, but you do need a license. And so I'm already seeing you as a licensed massage therapist. So, uh, and that's something that you can take forward yourself for your own practice. But let me talk about how this is going to go today so that you know what to expect. Uh, so we do our class in three parts. The three parts are one, we talk about strategies for the MBLEx. And I give you different strategies that have to do with taking a test. So that's in part one. Part two is our learning. We've got a lot of learning today because we're talking about pathology. Pathology is just a fancy way to say dysfunction or disease. So pathologies of the body we'll be talking about today. And then we'll be dissecting questions. Yay! Yes. Um, so that's our class in three parts. And the strategy that I wanted to share with you today, let me just briefly confirm because I like to keep myself on track. Yes, we've talked about this in the past, but it's controlling what you can control. And I like to do a mindful meditation now and then. And so here, and if you're listening to the recording, go ahead and take this opportunity to just get grounded with us. Know that the vibration of my voice, as it goes to you, those people who are live here in class, we are actually sharing a common brain as we are focused here together. So let's take 2 minutes, just 2 minutes, and calm our brain. This is a technique that you can use while you're testing. Yes. So while you're actually testing, you can calm your brain. Let's do it together. If you're not driving or you're not at work and you're supposed to be looking like you're working. Yeah. Okay. So feel yourself sitting in your seat. I happen to be sitting on a ball. That's why I'm a little bouncy. It's a big exercise ball, but feel your sit bones underneath you. Your sit bones, your ischial tuberosities sitting underneath you, sitting like in yoga, sometimes they tell you, pull your butt cheeks back and sit on your sit bones so that they are touching the seat, they're touching whatever you're sitting on. And from feeling yourself sitting, bring your awareness down to your knees. In fact, you can even put your hands on your knees. And from there, bring your awareness down to your feet. Yeah, right down to your feet. And flex and extend your toes. Curl your toes, extend your toes. Grind your plantar surface into the ground. Just push or turn your feet so that the bottoms of your feet, you can feel them in your shoes or you can feel them on the floor. Just give them a little back and forth, almost like you were making holes in the sand. And just feeling those feet on the floor. And with your attention, breathe in and the next breath into those feet. So that breath is going to go in through your nose, hold at the top, and send that down, that breath down to your feet. Imagine that you are sending oxygen to your feet. Studies have shown when we concentrate on sending oxygen to a certain part of our body, the oxygen saturation levels increase. We can be intentional. With that next breath, let's send some oxygen, send some air to our knees. Maybe give your knees a little squish with your hands and breathing in through your nose. Yes, bringing that attention to your knees. And now to your hips. Maybe even taking your hands and putting them on your hips in a sign of strength. Elbows out to the side. And breathe some air into your belly. Hands on hips. Breathing in, hands on hips. Stare at me. Stare at that computer. Hands on hips one more time. Yes. You can relax those hands, either palms up or palms down, laying on your lap. And in this moment, we invite the chaos, the busyness, the activities of the morning, of yesterday. We invite them to just be outside the room, to be out behind the door, to be behind us. And in this moment, we are here. We are present. We are present and ready. Studies have shown that by placing your hands on your hips, elbows out, that is a power move. That is a power stance. It's how superheroes stand. And I invite you to use that stance, that superpower stance, that superhero stance with hands on hips, even if you're sitting, to change your vibration. Yes, this is a strong stance. And in this moment, we are strong. In this moment, we are present. And in this moment, we are ready to receive. So that exercise simply brings us to the present moment, because there's so much that happens, right, prior to getting here, right now. Thank you for using what we call a mindful meditation. It doesn't have to be all like on a yoga mat with a lit candle. It can be in the Pearson View Testing Center, where you bring your attention to your feet, to your knees, to your hips, hands on hips. And you say, yeah, I got this. Yeah. And today, you've got this. Let's move into our learning. And here we are. Let's go ahead and I'm going to try this in a different way. Okay. All right, thanks for your patience. All right, there we go. Here we go. So I like to be able to see everything at the bottom of the slide. Sometimes it's a little confusing for me, but we're going to be talking about pathology today. Feel free to stay in that calm, confident, centered place as you listen to this information. Welcome back. So glad you're here. Glad that you are taking this time to prepare for the MBLEx, the Massage and Bodywork Licensing Exam. So what are we going to cover today? We are going to cover contraindications. We are going to cover the names and descriptions of a number of different conditions that I want you to be familiar with. As you get questions about pathology on the MBLEx, they will get harder and harder. Yeah, that's normal. And so, in fact, we just had a successful, Angela just sent me a note saying, oh my goodness, every question seemed to get harder and harder and harder, and it was freaking me out. Know that that is part of your test taking experience. As a computer adaptive test, it is going to get harder and harder. Yeah. So, so just know that that's going to be a part of your experience. All right. Let's see. There we go. All right. So sorry for my, there we go. All right. So know that that is going to be a part of your experience with the test, that you're going to get harder questions. That means you're doing well. Bonus, right? All right. Just need to do a little housekeeping here, make sure. All right. Gonna do our best here. Okay. So what else are we going to cover? We're going to cover the conditions. We're going to cover thrombosis and phlebitis. We're going to talk about people who have a pacemaker. We're going to talk about psoriasis and eczema. We're going to talk about osteoporosis, epilepsy, and then some common medications. All right. Sorry, I'm going to have to pause here for a second because I need to do a little housekeeping. All right, we're back. Very good. So here is what we're going to cover. All right, so let's start with some contraindications. Contraindications, we have both general contraindications, global contraindications, anything that means full body. Then we also have local or specific. There are two types of contraindications. Local means a specific area. General is anything systemic. So this is contraindications for massage. This would be a reason that we wouldn't be able to do a massage. So that would be things like fever, anything that's contagious, anything that is systemic. Yeah, and even so, it's going to be your call too on some of these things, whether you think it's a general contraindication or you think it's specific. Because at different points of the progression of a pathology, at one point it might be general, but at another point it might be specific. So for example, the last bullet point here, skin irritations that could spread, such as poison ivy. So skin irritations that are systemic. Now, depending on where your client is in their cycle of poison ivy, if they're at the tail end, that could be a specific, a local contraindication because it's dried up, it's not oozing. If it's oozing, that tells me they're still fighting the condition and it could spread. So just to be clear, fever, cold or flu, and then, so systemic conditions that generally will contraindicate. We'll get the purpose of identifying general contraindications is that massage would make it worse. Okay. So for the local, This would be, say, a fracture of a bone. This would be, yeah. This would be varicose veins. So specific area, right? So things that are undiagnosed, lumps or bumps, bruising, cuts, abrasion, sunburn, these eczema, these are all local contraindications. So local, meaning avoid the area. We'll see if, an example of this again in just a couple of minutes. But let's move on to some of these conditions that you may or may not have heard about. And that is, let's start with thrombosis. So what is thrombosis?
Blood clot.
It is, yes, very good. Yes, it is a blood clot. Exactly. Yes. All right. All right. So there are two main types of blood clots, the venous thrombosis and the arterial thrombosis. And you can see that the venous thrombosis is going to happen in a vein. The arterial thrombosis is going to happen in an artery. These are contraindications, but they are also, they can be a contraindication, but they're not always a contraindication. Before we move on, thrombosis usually resolves itself. Unless it is a deep vein thrombosis, again, we want to avoid that area. When we talk about undiagnosed lumps or bumps that you can palpate in the skin, we have to consider that there's a possibility that it could be a thrombosis. It could be a blood clot. And so we avoid the area. Now, phlebitis, all these itis, thrombosis, phlebitis, you may have heard of this term before, but weren't sure exactly what it was. Have you heard of a phlebotomist? So a phlebotomist draws blood, right? So that's who we see when we go for our annual exam and we need to take blood. The phlebotomist is taking our blood. Well, phlebotomists, they also do a few other things. They, apply the bandages, they sterilize the equipment. Just so you know what they do, they update medical records. But phlebitis means inflammation of a vein. So thrombosis is a clot. DVT, deep vein thrombosis. Phlebitis is inflammation of the vein. Now that can happen because of a clot. And you'll see here this example of superficial thrombosis, also called varicose veins. So you've probably seen these before. Maybe you have a family member who has phlebitis or varicose veins. It's hardening. It's a little bit, you can feel it. It's a little hard under the skin. There's usually some redness. There's some elevation of the vein. We see it a lot on the lower leg, but it can actually, phlebitis can occur in any of our veins. Sometimes it's in different areas of the body as well. And look at that, thrombophlebitis, right? We just talked about thrombosis. You may see on the MBLEx something that says thrombophlebitis, simply referring to the vascular system. Thrombosis, veins, blood clots in veins. Okay, so thrombophlebitis, it's going to indicate that it is a superficial experience and being caused by the clot. But both of those conditions are dealing with the circulatory system, right? So whether it's veins, arteries, we're seeing these two are interrelated. So in phlebitis, it's usually not serious. It's something that normally resolves itself. But if there is pain, so what causes it? Let me also get to what causes this phlebitis or thrombosis. So it's inflammation of a vein. There can be superficial thrombophlebitis, or it can be DVT, deep vein thrombosis. So what are the causes? Usually it is a blood clot, but sometimes it can be where the IV got inserted. And so if it is something that is a clot, the way that they typically will treat this, the way doctors typically treat this, is to put the client on blood thinners to help resolve that clotting, because what we're looking to avoid is a pulmonary embolism. So throwing a clot, so a pulmonary embolism would be in the lungs, um, and that's typically where that blood would be going back to get oxygenated. So what causes phlebitis? What causes DVTs? Um, if you have a history of it, sometimes a lack of movement. We hear about it on airplanes, right? That people took a long flight and had a clot. It can be from injury to a vein. It can be from the pressure from pregnancy. You know, when a woman gains all that weight, gains all that fluid in her body, that can cause some phlebitis, some inflammation of the veins. The blood is not moving back as quickly as it was. And some health conditions also can cause phlebitis. So phlebitis, inflammation of the vein. All right, let's move along here. And feel free to throw any questions in the chat if you have them. If I don't get to them right away, I'll get to them later on. So here we are talking about the pacemaker. So is the pacemaker a general or a local contraindication? Is it a contraindication at all? A pacemaker is actually a local contraindication where that incision site is, and it's typically on the left-hand side, but it can be on either side. And also, um, you can see here in this example that this patient has healed very smoothly from the insertion of the pacemaker. It is considered an endangerment site or a local contraindication simply because you can feel the equipment, and sometimes with deep pressure can even dislodge a wire. Not good. Look at these examples. So this is more recent after surgery. You can see the wound is still healing. Any wound like this would be a local contraindication. We want to stay away from that healing wound, right? Here you can see in this patient's case, you can actually see the device. And on some people who are skinny, you can, and even not even, if that, depending on how much muscle tissue is here in the chest area, that equipment can sit up a little on the ribs. And so obviously, this would be a contraindication for massage, a specific or local contraindication for massage. All right, we're moving quickly through our material today. Let's go into psoriasis and eczema. All right. Is psoriasis or eczema a local or general contraindication? It's a skin condition. They are both local contraindications. We want to avoid that area. Here's why. You can see psoriasis or eczema shows up as dry, flaky skin. And we see that, and different things cause it. Stress can cause it. A reaction to laundry detergent can cause it. It's usually a systemic condition, but it will not be made worse by massage, although we do want to avoid the area. And sometimes it kind of shows up by surprise. You might go to actually do some work on that scalp and, oh, wait a minute, I'm feeling some psoriasis, I'm feeling some eczema. Work around it. No need to avoid the entire neck area. Just avoid those areas that are dry, flaky, and probably itchy, because it'll make it worse. Here's some example of some eczema on the arm. And please make a note here, I'm talking about psoriasis, not cirrhosis. So psoriasis is a skin condition. Cirrhosis is a liver condition. All right. Next, let's talk a little bit about osteoporosis. We're talking about all sorts of different pathologies today. And this is not a comprehensive review of the conditions that we're talking about today as far as learning the new conditions. We're speaking to these conditions in terms of learning them for the MBLEx and learning them in terms of the lens of massage therapy. And if there's any contraindications or session adaptations that we would need to make for massage. And this is what you're going to be tested on for pathology. You're going to be tested on what is it, right? So we'll need to know what it is and what it's not. And then also, what are our session adaptations? And osteoporosis is a great example of a client that we can work on, but that we may need to have a session adaptation. First of all, what is osteo? So osteoporosis is a bone disease. Osteo is hereditary. You can't catch it. It's hereditary. Arthritis is hereditary. You can't catch it. Okay? Remember when we were told as kids, if you cracked your knuckles, you'd get arthritis? It's hereditary. You can't get it unless it's a part of your DNA. You can't catch it. You can create the inflammatory conditions through repetitive stress, but only those people who are vulnerable with their DNA are going to get something like rheumatoid arthritis. But let's stick with osteoporosis. Osteoporosis is a bone disease when the bone loses bone mass. It is typically found in women, but men can have it as well. But that bone mass, the mineral density in the bone mass gets lighter. And that means that when that density of the bone changes, it gets lighter, people are more likely to have fractures. The strength of the bone changes. The bone gets weaker. And so this means that they are more likely to have, someone with osteoporosis is more likely to have a bone fracture. We see sometimes the images of osteoporosis, and what we see is that it causes back pain. So it is an increase in the curve here in the thoracic region, and this is called a kyphotic curve or kyphosis of the spine, and it gives that hunched back appearance. This can also lead to bone fractures because we see it in the spine, but it can affect other joints. One more picture of a spine. Here's an elderly woman with a large kyphotic curve. Now, you may not see this until you get them on your table, right? And so, I mean, they can be wearing clothing that hides this kyphotic curve. And so we are going to need to have specific session adaptations available and ready just in case, especially if you're working with an elderly population. So osteoporosis, its early origins is called osteopenia. Same family, just the osteopenia is the early stages of osteoporosis. And what we can do for osteopenia or osteoporosis is we will need to adjust our pressure, and we will need to use pillows to bolster. So we will need to use a pillow to bolster the head, and we may need a larger pillow under the knees. Depends. And we ask the client, is it comfortable? Are you comfortable? So those are some session adaptations that we may need with this pathology. Makes sense, right? Now, also know that studies show that exercise, weight-bearing exercise, you can see here the weights in the background, and massage help to prevent and control the degeneration of osteopenia. Osteopenia, if left untreated, turns into osteoporosis. The way to prevent or control that degeneration is through weight-bearing exercise, and also massage therapy can really help with the pain that the patient may be experiencing. All right, you ready to move on? let's talk about epilepsy as a pathology. We're all over the map today. I know we're like, dun, da, dun, da, dun, da, dun, da, dun. That's pathology for you. All right, what is epilepsy? Well, normally we hear about epilepsy when there's a seizure, right? But epilepsy is not contagious. It affects people of all ages. In fact, 1 out of 10 people in their life, 1 out of 10, 10% of our population will experience a seizure at some point in their lifetime. We're not really sure what causes the seizure, but epilepsy is considered to having 2 or more seizures in unprovoked seizures in a lifetime. So seizures don't always come from epilepsy, but we're talking about an epileptic episode now. So about 50 million people in the world have epilepsy. It's one of the epilepsy. It's one of the most common neurological disorders. But about 70% of those people, I mean, they live a completely normal life and we would never know. Now, what causes it, we're not sure. There's many possible causes. We know what happens. It's the neurotransmitters that are nerve sting-building chemicals in our brain that get a little confused. Now, causes of epilepsy or causes of a seizure could be tumors, could be having a stroke, could cause a seizure. There could be brain damage. There's all sorts of different reasons, for brain seizures. But for the majority of people dealing with epilepsy, there's no really real cause. Again, it's just that those neurotransmitters. Some people can look to hey, I had a blunt force trauma to the head. I started having seizures after an accident. I started having seizures after I played football, or soccer. But epilepsy is really considered 2 or more seizures. 1, nah, could have been a hot day, could have been heat stroke, right? But 2 or more, then we look at labeling that with, hey, we may need to treat this. Now, as a massage therapist, do you call 911 for an epileptic seizure? Normally, no, actually. Depends. There are reasons to call 911, and we'll talk about those in just a moment. But stay calm. Here's what you do if you suspect someone's having a seizure. Stay calm, stay with the person. Keep the other people calm. This is normally not life-threatening. They just need to go through this. It's not fun, and it's a little disturbing, but it's normally not life-threatening. Now, if they have food or fluid in their mouth, roll them on their side. They will have dropped to the ground most likely, or be in a chair. But know if they have food or drink in their mouth, so they'll need to be able to get that out of their mouth or to possibly throw up. So just keep them safe. Move heavy items like chairs and things away from them, because sometimes there's some spasms, some spasmodic movements with a seizure. And if you can find something, put something soft under their head. That's a little bit more comfortable. And stay there to reassure them. And just know that, don't try and control the seizure, observe it, and be there to reassure them that this is going to be okay, because you're right there, ready to call 911 if need be. So when do we as massage therapists call 911? If they've never had a seizure before, we don't know what's going on. Like I said, seizures can be caused not just from epilepsy, from a confusion in those neurotransmitters. It could be a tumor. It could be a stroke. It could be a brain injury. So if they've never had a seizure before, go ahead and call that. And this is for the MBLEx, you guys, right? So we need to know, like, when do we actually call for backup? If they have difficulty breathing or walking after the seizure, if it lasts more than 5 minutes, yes, go ahead and call 911. If the person has another seizure in quick succession, good idea to call 911. Remember, 2 or more is a condition we need to treat. If the person is in water and they're having a seizure, they're swimming in the tub, in the hot tub, it could be dangerous. They could be overheated. They could drown. Yeah, So go ahead and call 911 if they're in the water. And if they have a condition that you know about, some heart disease, um, diabetes, again, this could be a seizure, can be a complication to a more serious condition. I'm just going to check my messages. Ooh, okay. All right. Let's go on. All right. So, ooh, there we go. All right. So our next slide says, it speaks, I put these slides in here because it was to remind me that this is a lot of information, you guys. It is, right? Some of these conditions you maybe heard of, but maybe didn't know exactly what they were. That's okay. You can go back and you can listen to this again. If you hear of a condition that you don't know of, then research that condition. I'm just going to pause us here for a minute. We'll come back to that. Yes. So we're going to take a little break here. We're going to make sure that everybody's on mute. So we're just pausing here for a moment because I'm not sure how to do this. All right. Good. So like I said, I put this particular slide in because it can seem like a lot of information. This might be you right now with all your books out and open, right? And you may be saying to yourself, oh my gosh, how am I ever going to remember everything? Just understand that there is a tipping point. There is a point at which, after listening to the YouTube videos, to these recordings, to doing your meaningful homework, if you've never heard of phlebitis or didn't know what it was, if you didn't know what thrombosis was, you're jotting that down, you're going back, you're reading a little more about it so that it sticks. And eventually, the beautiful thing is that there comes a tipping point where there is a growth of the knowledge, a growth of what you know. Sometimes, we don't know what we don't know. And maybe your first experience with the practice exam was like, holy mackerel, I didn't know this. That's okay. That's what those practice exams are for. Eventually, when you are taking a practice exam, and I see it happening all the time now, honestly, all the time now, where all of a sudden I'm seeing scores of 85%, 90% on the practice exams. Yeah, because that accumulated knowledge, yes, sometimes you get the same questions, but rarely, unless you're taking lots of practice exams. But you start to remember those things that you got to learn through either taking the full-length classes or through taking the practice exams. That's what I mean by a tipping point, where you don't know you didn't know, and then all of a sudden you do know. And you do know. And those scores start to reflect your readiness to take the MBLEx. And feel free to reach out to me. Hey, Jodi, do you think I'm ready? Because at some point, that knowledge just starts to flow. It really starts to accumulate and stick. And you're doing meaningful homework that you're like, okay, I got this. No, I got that. I got this. That's when you see that tipping point and you're starting to get over 70% on the practice exams. That's when we know you're ready. We look at the timing. Yes. We look at how long it's taken you to actually do those tests, because we want to come in under 2 hours eventually. And I'll mention here that since everyone who's watching this is in our Patreon community, that when you take the practice exam, you can take it one of two ways. You can take it like a traditional simulation of the MBLEx. So you are practicing, you are shooting to get done in under 2 hours, you are going straight through, not going back and forth. You're simulating your experience with the MBLEx. Maybe you're taking it at the same time of day that you're actually taking your actual exam. That's a simulation of the MBLEx. That's one way to take a practice exam. Another way to take a practice exam is as a learning experience. The timer on that test is actually 4 hours. That is to allow for the second style of taking a practice exam, and that's to learn, to work through the practice exam as a learning experience. And what you will do in the learning experience is you will Google things you have no idea what I'm talking about. You open a separate window and Google it. See if you can come up with the answer. Yeah. Now, will you score better? Sure, you'll score better because you're trying to get to the right answer. But that is also going to take you longer. That's why you have up to 4 hours. But the intention of that style of exam is to learn, to Google things you don't know, to get to the proper answer, to the best answer. So 2 styles. You can simulate the MBLEx, or you can go through the practice exam as a learning experience. Yeah, either way, we're building your knowledge. Because I want to see that pass. I want to see that picture of you holding your MBLEx paper saying passed. Okay, we're going to run through a couple of medications before we move into our dissecting of questions. All right, these are medicines we've reviewed before, but I'm going to review them again because they're they're very common medications that your clients may be taking. So let's walk through those. These are some of the most common medicines in the United States. As of 2020, I'm sure they're changed in order a little bit, but let's look at this. So the name is the generic name of the medicine. In the parentheses is I forget what it's called now. Is the medication that is a brand name. So the brand name of the medication. So the common name, the general name, the generic name, and then the medicine's name. So we're going to talk about Zestril to start. Now, notice here, I've highlighted Linezpril, PRIL. Take a look at this. So this is an ACE inhibitor. It's a blood thinner. Excuse me. Let me take that back. Let's start over again. So Zestril is an ACE inhibitor. It is usually given to people who have high blood pressure. The way this drug works is that it changes the constriction. We don't need to know more than that, other than to say it's a very common medication with people with high blood pressure. Hypertension is high blood pressure, okay? A lot of people are on high blood pressure medicine. In fact, so many people, as soon as they turn 65, the doctors want to put them on an ACE inhibitor or something to work with so to put them on a high blood pressure medicine or something to treat their cholesterol, because normally both are a little elevated. Let's stick with this. This is an ACE inhibitor. It speaks to controlling high blood pressure. So I did go on to explain that it relaxes the blood vessels and prevents narrowing of the blood vessels. So it relaxes those and allows, so that decreases high blood pressure. It allows things to stay in a more controlled state. So, but take a look at this. Why are ACE inhibitors prescribed? Well, obviously hypertension, but also, you could be having chronic kidney disease. You might have had a heart attack, migraines sometimes. This is specifically to deal with the pressure, the high blood pressure. And these are some of the symptoms that an ACE inhibitor will treat. Take a look at the common suffix. So we talked about, in the past, we've talked about prefixes and suffixes. Pre in the front of the word, suffix in the back of the word. Almost every one of these ACE inhibitors ends with pril. All of these. So that's a good indicator that it's an ACE inhibitor set to treat high blood pressure or hypertension. All right, let's move through these because I want to save time for our questions. Synthroid treats thyroid. It treats the thyroid. So right there in the name, right? Synthroid, thyroid. See how similar those are? And those actually treat hormone levels in the thyroid. Amoxicillin, probably maybe heard of that before, but amoxicillin is used to treat bacterial infections, not viral infections. In fact, amoxicillin is one of the most overprescribed antibiotics because it is prescribed to treat. And we have bacterial infections, and then we have viral infections. Antibiotics don't treat viral infections. So as you can see, the CDC, the Centers of Disease Control, tell us that about 1 out of every 3 prescriptions for antibiotics is unnecessary. Why we care? Just as a licensed healthcare professional, you care about the overprescribing of antibiotics because we become resistant to those antibiotics when they're overprescribed. So there's what it says is an antimicrobial resistance. So they're not as effective. Yeah, never mind what it does to the bacteria in the belly. Now, you may get that question on the MBLEx, so I will speak to that. Antibiotics take out all the bacteria, the good bacteria and the bad bacteria in your belly. And so many times it's a good idea. I would say almost every time it's a good idea to use yogurt, to use kefir, to replace that good bacteria, those digestive enzymes and that good bacteria in your gut. Ibuprofen or Motrin, it's used as an NSAID, an NSAID. Okay, so NSAID stands for a non-steroidal anti-inflammatory drug, an NSAID. That's how it's pronounced. Usually for headaches, muscle pain, joint pain, ibuprofen. Adderall. Do you remember what Adderall's for? Yeah, it's for ADD or ADHD. So Adderall is used for attention deficit hyperactivity disorder. So a lot of times school-aged kids are given this as a prescription because it is said to help with the restlessness. And this drug, Adderall, treats the central nervous system to help treat anxiety. It's helped to treat more restlessness than anxiety, but it helps to improve concentration. We're going to talk about another drug that's specifically for anxiety. So Adderall is associated with ADD, ADHD, improving concentration, and decreasing restlessness. Finally, Xanax. And Xanax works by increasing the GABA production. So GABA is a neurotransmitter, and Xanax increases the production and gives people a feeling of well-being. It is used to treat anxiety, and it helps a lot of people, man. It helps a lot of people not be so anxious. Oh, but it is good to know that Xanax is in the family of benzos. And I'm not even going to try and pronounce that, but right here, benzo, yes, So it creates a calming effect in the body. So not just for anxiety, but for insomnia, um, some seizure disorders, panic disorders. Um, Something that we will want to know as massage therapists is that, like any medication, as with most anti-anxiety medications, the people who are taking this medication need to adjust to it. And so when they first start taking it, they can feel a little funny, they can feel some side effects till their body regulates it. And then if they go cold turkey off of it, they can also feel some side effects. Not a bad time to get a massage, actually, if they're going off of it or they're going on it. And the body is trying to get into homeostasis to regulate this new medicine to help with their anxiety. Okay, we're going to dissect some questions. Shake it out, shake it out, shake it out, shake it out. We only have 5 questions, so, but we're going to work through these. Okay, just remembered, I don't think I put the answers. All right, it's now time to dissect some questions. Are you ready? Okay, I know there's been a lot going on in class today, so just clear your brain. Remember, we're going to employ our strategies of dissecting questions, which is fully understand the question, eliminate 2 wrong answers, and or eliminate at least 1 wrong answer, and then get to the best answer. All right, let's go. Thrombosis and phlebitis affect what system of the body? All right, we talked about this earlier. Thrombosis and phlebitis affect what system of the body? Would that be the integumentary system, the central nervous system, the circulatory system, or the peripheral nervous system? All right. Now, if you know your systems of the body, you know what the integumentary system is. The integumentary system is the skin. Yes. So we can eliminate that. We see some evidence of it we see some evidence of thrombosis and phlebitis in the skin, but that's not the best answer. All right. The best answer, have you decided? Yes, it is letter C, the circulatory system. Thrombosis being deep vein thrombosis, the phlebitis being inflammation in the vein. So there you go. Excellent. Next question. True or false? A pacemaker is a contraindication for massage. True or false? A, true. The client could have a heart attack. B, true. It's a local contraindication. C, false. After the client has fully healed from surgery, there are no concerns. Or D, true. The client needs a doctor's note. Can you eliminate one of those answers that you know isn't right? Well, we know we've talked about the pacemaker as a contraindication for a massage. So after the client is fully healed, there's still some concerns. What do you think? All right, ready? It is true. A pacemaker is a local contraindication. So we want to avoid that area, right? We want to avoid the area where the pacemaker equipment might be, and we might dislodge some wires. Yeah, that wouldn't be good. To treat a client with psoriasis, we need to, A, if the client mentions it, then you can ask if they're embarrassed about it. B, understand they're probably an alcoholic, but then they're in treatment, so it's okay. C, avoid the area. D, avoid talking about it because it could be a touchy subject for the client. Okay, we talked about this earlier, psoriasis. Psoriasis, it sounds like something else, but we can eliminate letter B because psoriasis is different than cirrhosis. Psoriasis is a condition of the skin. Cirrhosis is a condition of the liver, spelt differently. Okay. So A, C, or D? Oh, the class got this one on point. Can't trick them with this one. C, we're going to avoid the area. We're going to avoid the area because it is a local contraindication. Psoriasis and eczema, both local contraindications. A client presents with a severe kyphosis. She's 75 years old and has been referred by her doctor for massage. What do? Avoid A, avoid supine position, adjust to lighter pressure. B, avoid prone position, adjust to lighter pressure. C, do all the body work in sideline, adjust to using just effleurage. D, use pillows and bolsters to make the client comfortable, adjust the pressure. Okay. Can you eliminate one of these answers? Which one would you get rid of? A lot of students in class are saying get rid of letter C. Yes, we're not going to do all the body work inside lying. We didn't even talk about that. You can, but that's not the best answer. Okay, of the three we have left, avoid supine, avoid prone, or use pillows and bolsters. The students in live class have nailed this. Yes, we use pillows and bolsters to make the client comfortable. And we check in with the client or we adjust using light pressure. All right, our final question. Ready? Lisinopril is a medication that treats what? Lisinopril is a medication that treats what? We talked about remembering the pril as a memory tool. All right, does lisinopril treat A, hypotension? B, it's an ACE inhibitor treating hypertension. C, anxiety. B, it treats bacterial infections and shouldn't be prescribed for viral infections. Okay, which of these do you see that says, oh, that's not right? Can you get rid of one right answer? Excuse me, one wrong answer? Don't get rid of the right answer. All right, the students in class say get rid of A, hypotension. Hypotension is weird. That's really low blood pressure. That's not what we're talking about. But lisinopril is a medication that treats, do you remember? The answer is B. It is an ACE inhibitor treating hypertension. Nice. Good work on that one. Good work. So just as a reminder, this is the slide that gave us the list of ACE inhibitors. Everything here ends with pril, has that suffix, pril. And so when we see pril, we know it's an ACE inhibitor and it's about high blood pressure or hypertension. Right. All right. Good job. Guess what? That's it. Woo-hoo! We are finished. We are done for today. Congratulations. My name is Jodi Scholes, and it is my pleasure to work with you today to offer you this information, this pathology class, as you confidently and calmly, hands on hips, prepare for the MBLEx. Prepare to pass the MBLEx. Have a great afternoon, and I look forward to hearing from you in our patron community. I look forward to seeing you in the next live class. We do this on Thursdays at noon Eastern, and I'm here to help you, again, confidently and calmly prepare to pass the MBLEx. Have a great afternoon.